Very good afternoon to all of you present here. I am Dr. Pankti BUCH, Junior Resident from the Department of Ophthalmology, AIOS Rishikesh, and I am here to present our study on comparison of microbial findings of corneal scraping and back button scrapings in patients undergoing therapeutic keratoplasty. So, microbial keratitis is one of the leading causes of blindness worldwide, and therapeutic keratoplasty is the preferred treatment for corneal perforations and non healing ulcers. Post-operative targeted treatment can be aided by preoperative corneal scrapings, microbiological cultures, and histopathology. But preoperative scrapings often fail to identify the cause of the infection due to prior use of multiple medications as well as topical steroids. In such cases, scrapings taken from the back of the back surface of the infected cornea during surgery can provide additional information. So, the aim of our study was to correlate the microbial findings of preoperative corneal scrapings and postoperative back button scrapings in patients undergoing therapeutic keratoplasty. Our study was a hospital based retrospective observational study done on patients who underwent therapeutic keratoplasty in the Department of Ophthalmology, AIOS Rishikesh, from August 2019 to February 2024. Ethical approval was taken from our institute. We included patients who underwent therapeutic keratoplasty in whom preoperative scrapings as well as back button scrapings was done, and patients with missing clinical or microbiological data were excluded from the study. Corneal scrapings and back button scraping samples were sent for gram stain, QH stain, fungal culture, and aerobic culture, and the results were compared. The mean age of our patients was 42.71 years plus minus 8 years with a male to female ratio of 1.8:1, and the most common reason for TPK being non-healing corneal ulcers in 72.6% of the patients. The total scrapings positive were 48.5%, in which the corneal scrapings positivity was 26.52% as compared to the back button scraping positivity of 34%. In corneal scrapings, 22.8% patients showed bacteria on corneal scrapings as compared to 77.1% which showed fungi. And in back button scraping, 13% patients showed bacteria on back button scraping as compared to 87% which showed fungi. This is a 2 by 2 comparison table between the corneal scrapings and the back button scrapings, which shows that the back button scraping positivity is significantly higher than the preoperative corneal scraping positivity. Our results demonstrated a significantly higher positivity rate for back button scrapings as compared to the corneal scrapings at the time of surgery. The increased positivity in back button was especially seen in patients of fungal keratitis, as fungi are more likely to penetrate the deeper layers of the cornea. In 23.9% of cases, different organisms were identified in preoperative corneal scrapings and back button scrapings, which highlights the complexity of microbial keratitis and the potential presence of mixed infections. So, in a study by Das et al. In 38 patients of therapeutic keratoplasty, the culture positivity of corneal scrapings as well as corneal tissues were compared. In a study by Savitri et al. In 1,000 patients of microbial keratitis, the sensitivity of gram stain and QH stain was seen, which was seen to be similar in our patients as well. In conclusion, back button scrapings are especially useful in a resource-limited settings where culture and histopathology might not be possible, and they can provide an added information to guide the targeted post-operative therapy. Thank you so much.
Yeah, good presentation, Pankti. So, one question, you included some cases which had a perforation.
Yes,
so, how many were those cases and what were the size of the perforation? Because generally, this will be relevant for doing back button scraping. If it is a very large perforation, you would not be able to get the back button scrapings as easily. So, I think I missed that, or whether you presented that. It's relevant in this setting?
Ma'am, in 23% cases were of corneal perforations, and the routine clinical acumen was used in patients where larger perforation, in larger perforation where glue BCL cannot be done, we did a therapeutic keratoplasty.
I presume that the two scrapings were not done on the same day.
Uh,
So one was
no.
done much pre-operatively.
No, ma'am.
Some therapy must have been tried, or
We did a preoperative corneal scraping on when we admitted the patient 1 day prior to surgery, and then the post-operative back button scrapings were taken on the day of surgery.
but don't you think they've undergone some form of therapy while waiting for the cornea, and and the positivity might be affected because they're already on drugs, topical drugs?
Yes, ma'am, that would be affected in patients. So that's why we wanted to prove that back button scraping is a bit better.
Wouldn't it have been better to have a treatment naive patient pre-operative and then post-operative compare it maybe?
Yes, ma'am, probably in further studies.
Thank you.
Thank you, Pankti. We can
Thank
have
you.